Hey, I'm Dr. Rene Piedra of the Miami Center for Sleep Apnea and Snoring. And today I want to go over some things that have been reported on various media outlets, especially online, stating that there is no benefit to the use of CPAP in patients with cardiovascular disease. Now, what they're doing is they are glibly, for lack of a better term, taking some of the scientific literature and just partly reporting the outcomes and how the trial was actually performed. This was what the reporting is based on the SAVE trial, where they took almost 3,000 patients, divided them up into two groups. One of them was placed on CPAP and the other one no CPAP. And these were patients with moderate to severe sleep apnea and cardiovascular disease. And what they did was, at the end of 4 years, they determined that there was no significant statistical improvement or outcome in cardiovascular patients when they compared people who did use the CPAP to people who did not use the CPAP. Now, the problem with this trial and what they're not reporting is that the group that was given the CPAP that supposedly did not have any benefit from its use only used the CPAP for 3.3 hours. And that in essence is a subtherapeutic dose of CPAP. There have been various studies that have indicated that there is significant benefit in patients with cardiovascular problems, and in fact, with any patient when CPAP is used or when the obstructive sleep apnea is under control. Take, for instance, the Wisconsin cohort study that determined that after 15 years, patients who had uncontrolled severe sleep apnea had a mortality rate of almost 40%. In other words, their mortality rate, the rate at which these folks died, increased by 40%. This is in the severe population. In the moderate population, in other words, in patients with moderate obstructive sleep apnea that went uncontrolled for 15 years, their mortality rate increased almost by 20%. So as you can see, there is significant benefit of maintaining your obstructive sleep apnea under control, either with CPAP or, if you cannot tolerate a CPAP, with oral appliance therapy. In fact, the American Academy of Sleep Medicine recommends for patients with mild to moderate obstructive sleep apnea, the recommendation is CPAP or oral appliance therapy, depending on what the patient prefers. And in severe cases, in other words, patients with severe obstructive sleep apnea, if they cannot tolerate a CPAP, which is the first line of treatment, then what they're recommending is oral appliance therapy. If you need any information on how to control your obstructive sleep apnea, click the link below now for our information packet. If you cannot tolerate a CPAP, whether you have mild, moderate, or severe obstructive sleep apnea, there is hope. Remember that the American Academy of Sleep Medicine recommends oral appliance therapy in cases like those where the patient does not tolerate a CPAP.